talk about a news release from the Brighton and Sussex University Hospital, which is in England. It's part of the National Health Service. And a lot of people are actually very upset about it because it talks about the concept of inclusive language. And I am beginning to suspect more and more that inclusive language actually results in excluding women. That's what it seems like. And I want to make it clear initially that this is not, they don't have to use this language with everybody. They are able to refer to biological women as women if they choose to, but it's a recommendation. And it concerns me because not only is it a recommendation, but in some of their material, they're really suggesting that their healthcare providers should assume this, that this inclusive language should be the default language, so as not to offend anybody. I also have some serious concerns about women who are in the care of a healthcare provider who has this outlook, especially if that particular person happens to be a man who claims to be a woman, because I think as a result of this mandate to use this inclusive language, if a woman is coming in for perinatal services and a man walks in who claims he's a woman, she's going to be in trouble if she points that out. She could be accused of being discriminatory or harassing. So again, it's sort of a way of undermining women's consent, taking away the language that's so important to being a woman. And
Is this similar, do you think, to what we talked about a few weeks ago with the Congress, the 117th Congress, replacing adding gendered language and taking out sex-specific language about mothers and fathers in favor of parents?
Right. Yeah, exactly. We're no longer able to talk about brothers and sisters. We have to talk about siblings. Again, this is all part of the push, I think, to really alter the language. And so this is some of this material is coming out of what's called the Gender Inclusive Language and Perinatal Services Mission Statement and Rationale. And the first thing I just want to look at, which is what has kind of been catching on in Facebook and Twitter, is I think this concept of chest feeding that is being pushed. So a mother no longer nurses her baby. A parent chest feeds their baby. And as
That really offensive.
that
I
really
find that
offends
really
me. It
offensive.
really
As a
offends
mom,
me.
as a
Yeah.
mom, I breastfed my children,
Yeah.
and I don't want to be told that I can't use that language or that language is no longer appropriate.
Yeah, and it's actually inaccurate too. Chests do not lactate, breasts lactate. You don't chest feed. A chest is actually a part of the body different from a
It's
breast.
like, that's your pectoral muscles, right?
Right.
That's your chest.
And so it's actually completely inaccurate. And so it's like we're modifying language so as not to hurt a certain group's feelings, but at the same time, it's making it kind of nonsense because, you know, as a mother like you, I breastfed my babies, and it was a very important thing. It was a connection. It was a time where I was able to rest with my babies. It was a time when I was able to gaze at them. And it was specifically the first time that I felt my breasts were functional and useful and not just something that sort of got in the way or garnered attention. So to me, it's sort of really doing disservice to women and to what breast's natural function is.
Yeah, well, I think about all of those nights that I woke up in the middle of the night to feed the baby,
Mhm.
and it was never a consideration that my husband would get up and do that unless I had prepared a bottle ahead of time, because my husband has a chest, but he can't breastfeed.
He
And
doesn't
in fact,
lactate.
he doesn't lactate. But in fact, men do have breast tissue. They do
Yeah,
have breasts. Men can get breast cancer, but they don't lactate
right.
because that is something specific to women. Um,
That's
and
such a good point because it sort of minimizes the role of a woman. If chest feeding were possible, then the dads could get up in the middle of the night and chest feed the baby just as easily as the mother could, or
I
I should
might have
say as
welcomed
parents.
that. I might have
Yeah,
welcomed that. You know, it's your
right,
turn. You get up. And,
right.
yeah.
But the fact is that's a role that a father cannot take, which brings me to another part of this, which is the parent or person. So throughout this guide, they talk about a woman or a person, um, the maternal or parental, and they talk about birthing parents. And so they're getting away from talking about mothers and women and trying to sort of again de-sex the language so that we're talking about persons and people and birthing parent. I'm like, no, it's the mother that does that. No matter how much my husband wanted to birth the baby that was coming out of me, he couldn't because he doesn't have the anatomy to do it because he's a man. So to take away that language, I feel like is just, it really is minimizing women and something that is unique to what women can do.
Well, and ultimately, doesn't it minimize everybody?
Yeah.
Doesn't this also take away from fatherhood?
Yeah.
Because I can't father a child,
Yeah.
no matter how much, I might wish I were a man. That's a specific, honorable role that only a man can play.
Yeah.
And just like I am the only one in our marriage that can birth a child and be a child's mother, my husband is the only one who can father a child and sire a child and be that child's father. And that's important. And why do we want to, as a society, de-sex ourselves?
Yeah,
Why?
diminish those roles that are so important. And we know they're important because psychologists have studied this and they know that children do better when they have a mother and a father and that these roles are important. And when a father doesn't fulfill his role, it causes psychological damage to kids when a mother isn't able to mother them. So like
Mhm.
you said, these are important roles that we're diminishing. And again, one of the things they talk about is the co-parent in this. So we don't have mothers and fathers anymore. We have a parent and a co-parent, which is interesting to me because what it suggests is that there's one parent that's of a higher status than the other. So you have a parent and a co-parent rather than a mother and a father. So one of those is the real parent and the other one is the co-parent,
That's
which
interesting. They wouldn't both be called we are
parent.
parenting.
Right.
Uh,
Yeah. I mean, that's what's interesting. Well, because it's the parent who gives birth and the co-parent apparently who helps
okay.
out. So they
Yeah.
talk about it used to be that skin to skin with the father was something that was encouraged in the hospitals. Now they say skin to skin can be offered to the baby's co-parent.
Mhm.
Um, the other language they're using is second biological parent. So you can be the first biological parent or the second biological parent, which is again interesting because it's sort of setting this up as
Yeah.
there's the first and then there's the second rather
I
than
guess
a
the
mother and
first,
father, which have always been considered important and equal roles.
yeah. And so I guess the first is whoever gave birth,
I
and
guess.
then second, well, that's awfully,
Yeah, I mean, to me, that language is really quite offensive. And if I were considered a co-parent or second parent rather than the father, I would, I would take issue with that. And so I wanted to read to you too about in this release of this new document that was released to explain the rationale. It talks about the legal framework in relation to perinatal care. And it talks about the Equality Act. This is again in the UK, so it's a little bit different. We have an Equality Act looming that is likely to have a very similar effect, however. And so it says the Equality Act of 2010 prohibits discrimination, harassment, and victimization of trans people in the workplace and wider society. So apparently calling a biological female a woman is now considered to be harassment, discrimination, or victimization, which, ugh, that gets pretty scary. And then it goes on to say, for perinatal services, it's important to note the broad definition of gender reassignment in the Equality Act, implying that a person does not have to have formally changed their name, their gender marker, be under medical supervision, or have had any hormonal or surgical treatments to be considered of having to be protected of this characteristic. So that document
that mean?
says basically you don't have to change anything about yourself in order to be considered the opposite sex. So-
Every time you think this can't get any crazier, somebody says, "Hold my beer,"
and it
and
just gets even weirder. I
let
mean,
me just
it's I can't even imagine like how healthcare providers are making sense of any of this because it's ludicrous.
It really is. And how do you provide good health care to someone if you're so concerned about what words you're using, and if you use a word that person doesn't like, and wait, what are the right terms? Yesterday I could say uterus, but now I have to say
Baby
I
carrier? Like, it's that insane. And I want to point out this document because I'm not making this up. It is that insane. There's actually this document called My Language Preferences, which they can hand out to patients. And not only does it talk about the birth parent and the co-parent. So again, they're codifying this concept of parent and co-parent as being somehow hierarchical rather than equal as mother and father, which is again very odd. But you can talk about anatomical terms for breasts, breastfeeding, breast milk, cervix, clitoris, labia, peritoneum, vagina, vaginal examination, vulva, and uterus. And then it says preferred terms. So in theory, I could come in and have preferred terms for all of those. And the healthcare providers would be expected to use my preferred terms. I mean, they could just be absurd. I could call my vulva my nose, and they would they would need to. I mean, they would need
they
to
need to
follow
respect
they
that. They need to respect
this.
that.
Right. I mean, it's just so insane. Um, and to me, this is setting the healthcare providers up for litigation because this is all under the auspice of the anti um, harassment, discrimination, violence sort of thing. And
Yeah.
so if they slip up and they actually call my cervix rather than my ear, which is what I want them to call it.
Yeah, they could be sued. I mean, that reminds me of what happened to Peter Vlaming, that French teacher
Yeah.
that right here in Virginia, who had a student who was a girl and came back to school and decided that she was going to transition to a boy. Well, he decided just not to use pronouns. He was trying to be respectful, but maintain his conscience. He did not believe that was possible for her to be a boy. Well, one day during class, she was about to run into the wall or something. They were in some sort of a game. And just off the cuff, he said, "Stop her, wait," used the wrong pronoun, which was
Ah,
actually the right pronoun.
ah,
And she reported him and got him fired. And
wow.
so people might be saying, "Oh, that's ridiculous. Nobody's going to get fired for making a
Well,
simple mistake." But he did. He
yeah,
got
they
fired for
did.
making a simple
And
mistake.
this is again, this is obstetric can be life and death situations. I actually had a very problematic delivery with my last son. Um, and I had midwives and a doctor had to be called and he came running in and he pushed the midwife out of the way because I was dying and my baby was dying. It was very serious. And if he had had to like look over all these preferred, before getting to me. I might not be here. My son might not be here. So this gets very serious, and it's also it makes it hard for the medical team to communicate because they all have to. Imagine if they had to learn words for all these different body parts for every single patient that came in. It would just be
Right.
insane. It would make it impossible to communicate. And the other thing that the NHS has done is they've actually made pronoun stickers that people wear when they come in. And so again, this is the whole idea that we're going to force people to adopt inaccurate languages. And it's again another thing that concerns me is that if I'm a woman who's in there having perhaps I've been raped and I'm having an exam and I want a woman to examine me. Well, if my doctor happens to be a man who claims to believe he's a woman, he gets to come in and examine me. And if I object to that, I could potentially be in trouble for harassment or discrimination. And so my ability to consent now has been taken away. And to me, that feels like a rape on top of a rape. I mean, if I'm not able to tell a male doctor that I want a female doctor, then to me that feels like another sexual assault because the requirement of a rape exam is fairly extensive and invasive. And if I can't stipulate I want a female body to do that, then then that's really problematic for victims of rape and sexual assault. The vast majority of violent crimes are committed by men. There is a difference. And so for a woman who's just been sexually assaulted to want to have a female caregiver is extremely reasonable, both because of PTSD, but also just because we know that men who claim to identify as women can use that to predate on women. And so again, these differences are important, and to just pretend like they don't exist and to make them all generic. I don't know if you remember, in I think it was probably maybe the mid 80s, where they came out with generic food, and you could go to this the grocery store, and they would have it was very, like, it would just have like flour on the bag. It would say flour. So it was generic. And maybe that was just something local here, but it just
I
said
don't remember
flour. And so you could get, you know, all the, maybe C and H sugar, you could get U and I sugar, and then you could get sugar. And it was cheaper. It was generic. It didn't specify a brand, but that's kind of what it feels like to me, is that we're all becoming generic humans. We're no longer male or female. We're no longer boys or girls. We're no longer mothers and fathers. We're just people. We all just boil us down to people, which is so ironic because this movement is all about diversity, and yet what this does is actually reduce us to being like the greatest common denominator.
Yeah, yeah,
Yeah.
that's a good point. So many things about this ideology. What they say is quite the opposite of what they mean. Um, the Equality Act is not equality at all. It's
No.
preferences for one very small minority of people at everyone else's
Yeah.
expense.
It really privileges one group over another in a way that to me is extremely concerning, because as much as we might want to identify out of our female bodies, we cannot identify out of what happens to us as a result of us being female. So it really is it's really privileging a certain group over another.
Yeah,
I would
if I'm about to be raped,
Yeah.
I can't say to that rapist, "Oh, I don't identify as a woman. I
Right.
don't
It's not
identify."
going to matter. Yeah.
Right.
Yeah.
He knows I'm a woman.
Yeah, he knows you're a woman, and that is probably what is most frustrating to me, is that because of our physiology, because of our biology, because of our female bodies, certain things can happen to us in a way. Men do not have to worry about getting pregnant the way women do. A man becoming a father is a very different experience than a woman becoming a mother. We're different, and to suggest that we should just pretend like those differences don't exist is really doing a disservice. And I think it's really got to be so confusing for children too, because now we have kids growing up in families where they don't have mothers and fathers. They just have parents and co-parents, or yeah, I mean,
On all these people now who are raising their kids as babies,
yeah, yeah.
and
And
I'm
it's
all
totally
for
based on gender stereotypes.
I'm all for not enforcing gender stereotypes. Little girl, if you like playing with monster trucks, I'll take you to a monster truck
Yeah,
rally. Little boy, if you want to dance ballet, I'll sign you up for ballet. But you're a boy and
right.
you're a girl,
Yeah.
and both of those are good.
And to say that the baby is identifying as a girl because the baby likes to wear makeup and dance is so sexist.
That's very stereotypical, isn't it? We're going to wait and see what stereotypes you
Right.
exhibit, and
Right.
then we will
And we'll
pigeonhole
put you in that
you.
box. Yeah.
Right.
So it's, to me, it's very offensive as a girl and a woman who's tends to be not conforming to gender stereotypes. I just find it profoundly offensive.
Yeah.
And the last thing I wanted to just point out is this poster that they have for the NHS now. It says, "Not all birthing parents identify as women or mothers." Again, we have to push this idea in a poster that there's such a thing as a birthing parent, and that person is not going to be the mother. Oh, it just makes me so sad when I think of these kids, and that when I think of my children and that connection that I had with them as their mother. They called me mama, and my daughter actually still calls me mama. and she's
Oh,
all grown up. But I hear that even now I get goosebumps because that connection was so important.
yeah.
I was her mother, and that was an important role. For that to be just sort of thrown out because people have some mental health issues and are uncomfortable with their body. These women who they're being deprived of the opportunity to embrace themselves as women because they're trying to be inclusive, when in fact what they're doing is reinforcing um, self-hatred that these women have for their bodies and their attempts to run away from themselves as being women. Um,
I think we're going to have a generation of kids who are really lost because
yeah,
they're not being moored or having that foundation in reality. I mean, kids, they have to understand what's real. And from that point of understanding what's real and true and solid and unchanging, then they can go out and take risks and go out into the world and find out, who they are and who they're going to be. But without any foundation, I mean, you're just kind of treading water the rest of
if
your
words
life.
if words mean one thing to one person and something else to another person, we really lose the ability to communicate effectively. I mean,
That's
this is
true.
this is really basic stuff. And for anybody who's saying, well, it doesn't matter because this is just a tiny part of the population that's doing this, I just want to look at this poster a little bit further because what's happening is that this inclusive language, and I hate that term, inclusive language, is being pushed, and so the healthcare providers are having to adopt it. Um, and this poster says, um, chest feeding and top surgery may require extra support. Offer your own pronouns when introducing yourself. So they're telling healthcare providers now that they have to adopt this ideology and introduce themselves with their pronouns. So again, if somebody doesn't buy into this, and I do believe it's much like a religion. So it's almost like suggesting that if you don't have the same religious belief as your patients, you have to pretend like you do, or you're going to get in trouble and potentially fired. Um, we're supposed to mirror the language that they use when they describe their own bodies, even if it's nonsensical. Um, and again, we're supposed to offer them a side room or antenatal room on wards so that they have more privacy than the other patients. So they're getting preferential treatment as a result of this identity that they have. Um, and finally, it says use inclusive language when talking to or about a group of people, and make sure that signs, leaflets are all gender inclusive. So again, they are they're saying there's this tiny group, so you don't have to worry about it. But then they're saying we're going to apply it to everything and everywhere. And I feel so sad for these healthcare providers who are being pushed into this because I think that they're at huge risk of being sued, of being fired. I think I saw an interview of a mother who had babies, and she was very adamant about them being babies, and she slipped during the interview and accidentally gendered her child. And so even people who completely buy into this ideology, it's incredibly convoluted and it's hard to keep up the pretense. And so even they make mistakes. If they make mistakes, how on earth are we expecting healthcare providers under, stressful situations to remember to use the right, the right
Yeah.
language that the patient wants to use for their vagina or for their uterus?
I've heard that too. I have a couple of friends who are extremely woke, and one talks about a couple of her friends who have transgender identified children. And my friend is 100% on board with this,
Mhm.
likes to kind of tell me how I'm not quite up with the times and all that. I'm a little aggressive. But in conversations, she constantly slips up.
Yeah.
She'll constantly use the correct biological pronoun for the person that she's talking about, even if it's an adult who has been transgendered for years. And it's so telling. It's just, this is fact. It's fact of who we are. We are born one of two sexes.
And again, I think about this sort of the trickle down effect that we're going to be insisting now that these doctors who are um, aiding women in giving birth, that they are randomly assigning the sex of the baby that's just born, because that's part of this ideology that they're assigning it rather than observing it, because we're no longer able to rely on our observations. And so I think that um, the fact that people are pushing back on this is really good. And I think we need to push back really hard. And it doesn't make us transphobic. It doesn't make us haters. It actually, to me, it suggests we care about people, because any woman who hates her body so much that she can't even talk about the anatomical parts correctly is really in need of some help, as someone who deserves compassion and love. But if we go ahead and say, we're going to just cater to those discomfort feelings that you have, and we're going to actually encourage other people to have similar responses to those uncomfortable feelings, it's really, like you said, we're going to create a whole generation of kids who are just unmoored. They're not going to have anything to base reality on. And they're going to be angry, I suspect, because they're going to be like, why is everybody being so weird? Why are they lying? Why are they making us lie? When adults are expecting children to lie, we know we have a big problem.
Well, and it made me think about, what about like people who self-cut?
Mhm.
We know that there are a lot of people who they deal with pain by self-cutting. If I go into the hospital and I've got slices all over my arm and the doctor asks me about them and I say, "Oh, those are my love tattoos. Call those my love tattoos." He can't address the fact that I am mentally, I'm having a mental problem,
Right.
because self-cutting is a problem.
Yeah, it's
But if
very
I say
dangerous.
it's not a problem, then nobody can address it with me. And how can I ever get help?
Right. That's a really good example. I think it's such a good example because it's self-harming behaviors, and that's what happens when people start to transition. They're engaging in self-harming behaviors and running away from who they are as an individual. So hopefully, people who are watching this understand that this is really coming from a sense of us wanting to stand up for women, wanting to stand up for motherhood, for nursing children, for breast milk, for the correct usage of words, and for us to also for safety and health, that we shouldn't expect healthcare providers to be able to remember to use these really nonsensical terms and words when they're in a healthcare situation that could be life or death.
Yeah, and if this progresses, the next logical step is that the textbooks and the training materials that doctors and nurses use will have to have this language in it. And how will anybody even know what they're learning, what they're talking about?
I have an image, Maria, of like a workbook with the anatomy. So you go to anatomy class, and rather have than the instructor telling you what the anatomy is, it's like a workbook, and you fill in like what you want your different body parts to be called.
Yeah,
And there would be no
maybe I'll call my hoo-has.
and there would be no final exam, because it would be unfair, because we would want to respect everybody's body
I don't
parts.
want a doctor who's been through that program providing me health care. No.
No, imagine like in when they're dissecting a cadaver, everybody's using different languages. I mean, somebody's going to get a finger cut off. I just and
It
it
is
is.
ludicrous. It really is ludicrous.
Well, I'm really heartened to see people pushing back on it, and I'm hoping that people who watch this video will stand up and say, this is not inclusive. This is really damaging.
So please come to our website, come to partnersforethicalcare.com. If you have any stories, if you have any questions, if we can help you with anything, if you want to know how to push back on some of this stuff, please come and visit our website.